My name is Lieutenant Colonel Aaron Elliott. I am an Army nurse anesthetist with over 16 years in service, including over 21 months in Iraq. As I near the end of my military career, I fear that I cannot return to my home in Pittsburgh. I am greatly disappointed that states such as Pennsylvania and North Carolina have not opted out of the Medicare requirement for physician supervision of nurse anesthetists. It's not that I can't, but I won't work in a system that I believe is fundamentally wrong. The problem is that there will continue to be a great deal of waste in these states' healthcare systems as long as nurse anesthetists are not freed to provide care to the full extent of their abilities. Healthcare costs will continue to rise, and access will become severely limited. Let me give you a little bit of background on this issue. The ability to opt out was a provision added by the CMS to their reimbursement policy in 2001. Which allowed an individual state's governor to opt out if they determined it was in their state's best interest. I have seen some incredible things which show what a nurse anesthetist can do, like the attack on Camp Bucca in June 2007. A mortar round landed directly on a detainee compound only 200 yards from the hospital, killing 8 and wounding over 70. What was the only thing on my mind? I knew that there were lives depending upon me, possibly American lives. The fact that there wasn't an anesthesiologist available within 50 miles didn't even occur to me. Nurse anesthetists have been providing battlefield anesthesia since the Civil War. This was nothing new. My nurse anesthetist shop had proven herself during this attack. We worked all day and all night to save lives and performed flawlessly. I told you this story to emphasize that just as in the civilian world, my commanders had a choice about who would provide their anesthesia. If nurse anesthetists have demonstrated their competency for years in the harshest of environments, why does the practice of requiring physician supervision persist? I'd like to touch upon the 3 pillars of healthcare to clarify this issue. The 3 pillars I'm referring to are quality, access, and cost. DeLeese and Cromwell performed a study entitled "No Harm When Nurse Anesthetists Work Without Supervision by Physicians" to determine if there is any difference in the quality of anesthesia outcomes delivered by CRNAs and anesthesiologists. For their study, the authors compared 11 opt-out states to non-opt-out states. The authors analyzed cases where the anesthesiologist practiced solo, the CRNA solo, or the anesthesia was delivered by the care team approach, where the anesthesiologist either directs or supervises the CRNA. The authors included 481,440 cases and determined that there was no difference in the anesthesia care that was delivered. Statistically, there were no difference in outcomes in any of the anesthesia arrangements. Furthermore, they found it would provide more cost-effective care. The next pillar of healthcare is access. Almost immediately after the CMS published their final policy in November 2001, states began to opt out, and so far 16 states have chosen to do so. The majority of the early states were more rural, where anesthesiologists were scarce and CRNAs provided the only means of anesthesia. The RAND Corporation recently produced a study which stated that there is a shortage of CRNAs and anesthesiologists in both the states of Pennsylvania and North Carolina. However, there will be a surplus by the year 2020. It doesn't even take into account the impact of the Obama administration's Affordable Care Act, which according to the Urban Institute will result in a significant shortage of healthcare providers due to an aging population and the influx of millions of previously uninsured. Therefore, CRNAs will be better positioned to meet these states' anesthesia access needs. If the status quo continues, access may become severely limited and lead to canceled or unscheduled cases. States such as Texas never required physician supervision. Why are these states lagging behind? In order to address these potential healthcare crisis issues, the Institute of Medicine has advocated the removal of all scope of practice barriers for all advanced practice nurses, including CRNAs. The final pillar of healthcare is cost. Have you been putting off an elective surgery because you couldn't afford to copay? If you're trying to ignore the pain in that aching joint while your mobility worsens, then my heart goes out to you. You shouldn't have to pawn the family heirlooms to pay for your surgery. Regardless of how you view it, residents of these 2 states are paying 2 anesthesia providers to provide 1 service. If costs were the only issue, then an independent nurse anesthetist would be the most cost-effective way to deliver anesthesia. In a study by the Lewin Group, a cost analysis was performed on several anesthesia models and determined that a nurse anesthetist providing anesthesia solo is more than 25% more cost-effective than the next model. Oh, and it only takes 1/6 the amount to train a fully trained nurse anesthetist as an anesthesiologist. Opponents to the opt-out policy do not have cost analysis data to support their claims. I can't go home to work in a system that controls how I practice and charges patients more than it should. If you're a policymaker and would like to balance your budget, or an average citizen that needs surgery and doesn't want to go bankrupt, the nurse anesthetists are the solution. Before I run out of time, I wanted to leave you with one last story. During my first tour in Iraq, I, along with 2 CRNA colleagues, were trying to save the life of a soldier with a live RPG round in his chest. I remember the specific moment when the blood bank officer came into the room to tell me that we'd used every drop of blood that the combat support hospital had. We CRNAs kept that patient alive long enough for the surgeons to remove the explosives from his chest. Ladies and gentlemen, there is no limit to what CRNAs can do if given the chance. In closing, removing the Medicare requirement for physician supervision of nurse anesthetists provides these states with the best chance to meet its future anesthesia access needs and decrease costs while not compromising care in any way. Thank you for your time.